Morning and welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, April the 7th. We are joined today by our CEO, Nicole Dupuis, our acting MOH, Dr. Shankar Nasathuri, as well as the manager of our epidemiology department, Ramsey D'Souza. We will start with opening remarks from Nicole, followed by the epi summary from Ramsey, and then move into media questions. Nicole, if you want to get started.
Sure. Good morning, everyone. Today, we wanted to start off by highlighting that April is National Oral Health Month. Today is also World Health Day, and it's also inaugural Canadian Public Health Week. So a great day to just highlight and acknowledge and thank all the work of public health and health professionals across the province, across the country, and in the world. Oral health is a key part of our overall health and well-being. Poor oral health has been linked to diabetes, heart disease, and other health concerns. This year's theme of our Oral Health Month is Oral Health for Total Health, which reminds us all that taking care of our mouth, teeth, and gums positively impacts our overall lives. Celebrating Oral Health Month provides us an opportunity to highlight the important role of our public health dental professionals and the great services that we offer at the Health Unit. The Health Unit offers 2 public health programs that aim to address oral health for vulnerable children and older adults in our community. We continue to support and have done so throughout the pandemic, the Healthy Smiles Ontario program, which is offered for children under the age of 18, or eligible children under the age of 18, and in a newer program, which actually launched just at the start of 2020, the Ontario Seniors Dental Care Program, which is offered for low-income seniors 65 years of age and older to receive preventative care and treatment through one of our 2 clinics. The Health Unit offers oral health services through our Windsor office at 1005 Olette, Monday to Friday from 8:30 to 8 p.m. and in our Leamington office, 33 Princess, Monday through Friday from 8:30 to 4:30. Before I turn it over to my colleagues, I also just wanted to highlight there are several announcements related to vaccination, increased vaccination eligibility for 4th doses. Our booking at the Windsor-Essex Health Unit will be up later today on our booking site. So individuals who are eligible 60 years of age and older for a 4th dose will be able to book on our website through our WeVax page. And bookings will start for our clinic at our Windsor office on Monday. Thank you very much, and happy to take questions at the appropriate time, and I'll turn it over to Mike.
Thanks so much, Nicole. Now we'll move into the epi summary from Ramsey.
Thank you, Courtney. Good morning, everyone, and thank you for joining us for this week's epi summary. I'll provide an overview of what the summary contains. To begin with, our weekly case rate for our most recent completed week has shown an increase of about 10% from where we were the previous week. Our case rate has increased to about 145 cases per 100,000 population. This is about the 3rd consecutive week where we have seen an increase in our high-risk case rate. When we compare ourselves in terms of our weekly case rates to other PHUs in the province, across the board, there has been a general increase in high-risk case rates throughout each and every health unit. Windsor-Essex currently sits and currently has the 8th highest high-risk case rate in the province, and there are some other health units that have higher case rates, mostly found in the northern region of the province, but also some locally, such as in Lambton County. Our percent positivity has continued to show an increase throughout the month of March. Currently, it's sitting just under 20% at 19.3%. This is about a 4% increase from where we were last time this week. When we look at our hospitalizations in the province and in Windsor-Essex has also increased. Currently, we're seeing about 46 cases that are currently admitted. For our most recent completed week, we had about 48 admissions, and for the same time frame in the previous week, we had about 50 cases. So we're seeing about 48 to 50 cases, 40 to 58 new admissions each week. Moving on to our local wastewater surveillance data, our wastewater surveillance data has also increased. We have seen a spike in the signal intensity for our most recent completed week. And it's it's that the magnitude of the increase is higher than what we were seeing in the past 2.5 months prior to the Omicron wave in January. We have, however, seen a slight decrease in our deaths for our most recent completed week, which was last week. We saw about 2 deaths compared to the 3 that we received the week prior to. However, week over week, we are continuing to see deaths in our region as it relates to COVID-19. With regards to outbreaks, we continue to experience outbreaks. We currently, at the time of reporting, had 14 active outbreaks. That has also increased as this week has progressed. In comparison, from our most recent completed week, we are seeing about 7 to 8 outbreaks during any given week for the past 3 weeks or so. Moving on to our vaccination status. We continue to see incremental increases in our vaccination status. Currently, for our 2 doses, for our primary series, for those 5+, our vaccination rate is at 83.5%. When we look at those that have received 3rd doses, for those 12+, it's at 51%, with the highest uptake amongst those 60 years and older. Just as in previous reporting, there is variation amongst our residents in terms of geography. Areas such as in the N9A and in the N9 NOP postal codes have a lower vaccination coverage rates, and there's lower vaccination coverage rates also in our hotspots, as we've seen in previous reporting. And that continues to be the trend in terms of what we observed for most of the pandemic as we've rolled out our vaccines. Overall, our indicators are showing an increase, and it's a continuation of where we were last week. So there is increased disease activity in our region across most of our indicators. Thank you.
Okay, thank you so much, Ramsey. We will move into media questions now, starting with AM 800.
Good morning, Doctor. I know we ask you this question all the time, but with the numbers increasing, like Ramsey said, I believe you said 3 straight weeks now, just your overall message to the community once again.
Well, we are very concerned. I think the Public Health Service is very concerned about the increasing level of disease activity. And the pandemic is not over. We continue to have people admitted to the hospital, and the number of people being admitted to the hospital is significant. I think Ramsey can correct me, but I think that we have nearly doubled, if that's correct, Ramsey. Maybe you can correct me on that, the number of people in the hospital. I think that my recommendation to the community is to continue with public health measures, wear a mask indoors, wear a mask if you can't remain 2 meters away from somebody else outdoors, minimize your human-to-human contacts, if at all possible, work from home. If you're sick, stay at home. All of those things will make a difference. And Windsor-Essex has suffered disproportionately from the pandemic. And I would encourage people to take individual level action to try to prevent or try to mitigate the growth in cases and hospitalizations.
I know my colleague Melanie asked this question last week, but have you or the team given any thought of maybe putting additional restrictions or guidance in place for Windsor-Essex?
At this point in the pandemic, I think that the province should put in additional public health measures. I think that we have we've had a number of weeks of increasing disease activity, and it seems to be a province-wide phenomenon. I think that the best approach is to have these measures be instituted at a provincial level, because it'll lead to some level of uniformity. The Health Protection and Promotion Act does give local medical officers of health a framework of the authority to institute orders at a local level. But my preference at this point in time in the pandemic, given the information that we have, is that the province effectuate a broader suite of public health measures to try to mitigate the increase in disease activity.
Sorry, so are you hoping that the province introduce more or introduce additional guidelines?
Yes, I think at this point in the pandemic, with the data that we have for these past 3 weeks, I think the province should effectuate greater public health measures to reduce the burden of COVID-19. I think vaccination is good, but I think looking at the case counts and looking at the disease activity, I think this is the time for the province to act. We have to act early in the course of increasing disease activity. We can't wait till this kind of approach requires earlier intervention than later intervention. And any measures that we put in at this point in time will take perhaps a week, 10 days, 14 days to really have an effect. And given that, and given our experience with the pandemic up to this point, I think it is appropriate for the province to act and put in some additional public health measures.
Thank you.
First questions from CTV.
Yes, good morning. What additional measures would you like to see the province add, whether it be masking or capacity?
Well, I think that there are a suite of measures the province could add. I think that is for provincial policymakers to make a decision about what those suite of measures should be. But I think one thing that we can do incrementally is to bring back direction related to wearing a mask indoors or wearing a mask when one can't be 2 meters away from another person. I think that's a good initial step. I am worried about additional cases coming, additional burden of disease to the community. If I could share that one of the goals of trying to reduce the increasing number of cases or to mitigate the current burden of disease is that we have limited hospital capacity in the province. And if you look at Windsor-Essex, many days the hospitals are full or nearly full. And Ramsey, if I could just ask, I think it's 46 people currently admitted to the hospital. I think there are approximately 600 beds in the health district. So right now, about 8% of the beds in the health district are used to manage people who are experiencing COVID. Well, what that means to our community is that as the number of cases increases, as the number of cases of COVID increases, the number of people going to the hospital and using hospital resources increases, which means that other important services cannot be provided to people in the community. I think the last estimate I got is there are 4,000 people in the Windsor-Essex Health District waiting for surgical procedures. So any additional burden in the hospital, I think, is concerning. The other item to think about is that the number of people being disqualified from work because of healthcare workers being disqualified from work is also on the uptick. And as healthcare workers are disqualified because of COVID exposures or actual diagnosis of COVID, that makes it even harder for hospitals to maintain their capacity. If I could share, we have to learn to live with COVID. We have to learn to, we have to recognize that COVID is not going to be eradicated in the immediate term. There'll be better medicines that'll come out. There'll be better vaccines that'll come out. But in the interim, as we learn to manage COVID, we have to put in a suite of measures to manage it, recognizing there will be times when there'll be more disease activity and there will be times when there's less disease activity. And it's likely moving forward, we'll have to spend more money on managing COVID and the healthcare resources for that. And it's likely that we'll have to spend more money on hospital and other healthcare resources to manage the pandemic. And it's likely that we're going to have an infrastructure to vaccinate people on a routine basis, just like we do for the flu vaccine. And it's likely that we'll have to accept the risk that certain activities, when larger groups of people meet, are more likely to, on average, to lead to more people getting sick. I think that's the plan that we have to think of moving forward as it relates to COVID-19. I'm sorry for that long-winded response.
Thank you. There's been at least 3 deaths in long-term care residents reported over the last week. Do you think there is a need for more restrictions in place in LTC?
Well, I think that we have to think of this the overall strategy of trying to contain, and we have to think of the measures that we could effectuate for that. I think the public health measures that are put forth in the suite of measures diminish the burden of transmission overall, including into long-term care and retirement homes. But one thing to think of is that the people that are in advanced age have suffered disproportionately as well from the deaths related to COVID. And I think this is worth noting. If we had 3 car crash deaths in a week, 3 or 4 car crash deaths a week in the health district, we'd be very concerned. So 3 or 4 COVID deaths every week is still something to be concerned about moving forward. And many of the deaths of people with COVID are people who are currently living in the community, and not exclusively people at the twilight or at the very end of their anticipated life. So I do think that we have to consider the burden of death as a significant item. If I could segue also into just a little bit about normalization, and this weighs on, I think, many members of the public health service. We have other priorities in health in addition to COVID, and as we move towards normalization, we should not also forget that approximately 2,500 people died of COVID, of opioid use and deaths related to opioid consumption last year. And that too warrants a significant amount of our energy and resources. So as we manage COVID and we normalize it and recognize that we have to develop a framework to manage the peaks and the troughs, we also have to think of how we get back to doing the other important public health work that we're doing, which is also affecting the community in a very significant and severe way.
Thank you. Nicole, maybe this one's for you. How is the rollout plan for 4th doses different now that the mass vaccination centers are closed?
So we're shifting to more of a focus on our pharmacies as the main focus of delivery for vaccination. And we do know, in particular for this age group, even with 3rd doses, about 50% of vaccines for 3rd doses for this age group actually were administered through pharmacy. And, you know, when we look at flu, actually majority of the flu vaccine is delivered through primary care and pharmacy. So, yeah, so our focus will be on our colleagues and partners in pharmacy for rollout of the vaccine. It's convenient. Certainly, we're lucky to have a really robust pharmacy structure in Windsor-Essex, as well as our healthcare providers. And then we'll continue to push through our mobile vaccination. So we do have a great team at the health unit that provides mobile vaccine opportunities as well. We partner with the CREST team, which is a collaboration between EMS and Erie Shores Healthcare, and they do provide and work with us to set up mobile opportunities for vaccination, which are walk-up opportunities or no appointment-based opportunities. As well, as I mentioned at the start, we will have a clinic at our site here at Windsor in 10050 Let. We think it's a great spot. We'll be able to do, you know, a decent number of appointments through our site here. And obviously we're in the downtown, our site's in the downtown area. So we think that that's it's a great spot to have an additional clinic as well. as I mentioned this morning, as part of Oral Health Month, we do have our oral health clinic, and we do welcome a number of seniors through our doors every day. So hopefully it's a good opportunity.
Yeah, if I could
you.
just supplement that as well. With this new initiative to get 4th doses of vaccine, Ramsey had shared with me, we have approximately 100,000 people in the health district who are eligible for the 4th dose of the vaccine. It's likely that there will be an expansion of 4th dose availability to younger age groups as well. That's what I anticipate. Reason that's important is that we only have 300 people who work for the health unit. And so it, as a long-term practical matter, a staff of 300 people are not going to be able to vaccinate hundreds of thousands of people over the long term. The proper way, the best way of managing health in the community is to recognize that family medicine physicians and nurse practitioners who work in primary care are the cornerstone of community medicine. And so as we move forward in the pandemic, the distribution channel for vaccines, which are going to be substantively family physicians' offices, clinics, nurse practitioners, pharmacies. That's the standard distribution channels that we use for the flu. Now, in an emergency, the public health service and hospitals can definitely step up and provide stopgap measures and interim measures to effectuate vaccination. But as we move towards normalization of COVID, it has to be recognized that the approach for delivery of vaccine has to go through the established channels in medicine.
If just to jump in for a quick second, so we have about 112,000 residents that are 60 plus, and 86,000 of them have received a 3rd dose, which is about 77% of those that are 60 plus.
Thank you.
First questions from CBC.
Yes, thank you. Dr. Nazatari, you touched on this, but I just want to ask, with hospitalizations rising here locally, I mean, how ready are our hospitals for this kind of increased patient care that might be given towards COVID?
Well, I know that doctors, hospitals, hospital executives, nurses, they're all working diligently and have for the last 2 years to try to meet the demand based on the increased activity and when there is increased activity. As it relates to where they are today, I think it would be worthwhile to ask the hospital executives of the hospital groups to comment on that. I think it's fair to say that hospitals are concerned about the number of workers who are being disqualified from work because of COVID-related diagnoses or COVID-related exposures. But I think that it would be best to perhaps ask for a comment from the hospital CEOs about that issue directly.
Ramsey, you talked about wastewater surveillance data. You mentioned a spike in the intensity for the recent week, but you said it was higher than we've seen in the past 2.5 months prior to Omicron. Can you tell me a little bit more about that? I don't think I caught exactly what that meant.
Right. So it was our spike that we're seeing right now. It's following the trend that we're seeing for Omicron when it hit towards the late month of December last year. So we are seeing a sharp increase, but between the Omicron wave and I say around the 2nd to 3rd week of March, we did experience a lower level of intensity when it comes to wastewater, but especially within the last week and a half, we are seeing a dramatic rise when it comes to our wastewater surveillance.
Thank you.
First questions from the Windsor Star.
Yes, Dr. Nazatari, I know it's not your job to manage public opinion, but I'm sure you're aware that reintroduction of measures at this point would be hugely unpopular and that there is a segment of the population, some would say an increasing segment of the population, who would simply refuse to comply. What's your response to that?
Well, I think that at the end of the day, the public health service and medical officers of health are apolitical. The legislature contemplated in our roles as medical officers of health and public health services based on the history of the province and the priorities, and it was particularly influenced by the by previous disease activity and levels. I think that as public health officials, we have to give our honest assessment of the level of risk to the community. Like other public servants, we're obligated to give a frank and honest and forthright assessment of the current level of risk and what the policy choices and options are. I think the vast majority of people are concerned, and when we share when the rationale is shared with them, I think the vast majority of people would be adherent to public health guidelines and on occasion direction. It is the responsibility of all people in leadership, I think, to sometimes share things that aren't necessarily popular. If I could share my experience as a doctor, in clinical practice in medicine, it's not what the patient wants to hear, but what the patient understands, and sometimes what the patient needs to know, so that they can make informed choices about their own health. In the public health service, if we could use the analogy, the patient is the community, and I think at this point, when we look at the data, and Ramsey and his team, and look at the provincial data, we have an uptick in disease activity. And if we have an uptick in disease activity, then we have to make policy choices to either accept the increase in disease activity and accept the consequences, or try to mitigate the disease activity and try to formulate a plan to reduce the consequences of increased disease activity. So we do the best we can at the public health service to serve the community, and we recognize that some of the decisions or positions that we have to articulate may not be immediately popular with every person in the community, and that is just the nature of working in the public health service.
You mentioned that you foresee in the future living with COVID would involve possible regular top-ups in vaccination, as well as awareness of increased disease activity periods. Do you also foresee measures coming in and going as a permanent addition to people's daily lives?
Well, I think a couple of things. I think if we look at the HIV, which was another public health crisis, as we have better medicines and better vaccines, we can modulate the advice that we might give people. But I think in the short and intermediate term, we're going to have periods of increased disease activity and decreased disease activity. And when we have signals of increased disease activity, we're going to have to likely consider more public health interventions. And when there's less disease activity, we may be able to relax those interventions. I also think that we, as a community, will have to accept that certain activities have increased risk. So going to a school dance, or going to a family wedding, or going to a college or university graduation, where larger groups of people might congregate, might lead to an additional risk of getting infected and potentially an additional risk of getting sick. So I think that we have to, as we move towards normalization, if we want to get towards a more normal place in our culture, then we have to make those tough decisions. I think normalization is not going back to the way things were before COVID for now. And I think that's a core message. it means that we have to make adjustments moving forward. That was true with HIV as well. You know, when HIV changed the sexual practices of a generation of people. And we had to learn to accept that as a plan moving forward. So I do think that there's going to be some modulation of the disease based on the level of public health interventions we offer based on disease activity. Again, my apologies for that long-winded response.
Not at all. It's very informative. Thank you.
First questions from Radio Canada.
Yes, thank you. Dr. Nisature, talking about the measures that you want to see put in place, I want to talk about farms. So I would like to know how the unit is handling COVID in farms during this sixth wave. Since a lot of measures have been lifted, we know that this is actually an at-risk population. So do you have any numbers? Is the situation in farms better now than what it used to be?
Well, we're concerned about all congregate settings, and that includes the residences of agricultural workers who live in these dormitory style or dormitory type of housing. It is more difficult for us at the Public Health Service to gauge the level of risk as testing testing reporting has become less robust. Nicole may comment on this, but I don't believe we've had a report of a single COVID case at the residence of an agricultural enterprise in more than a week, perhaps 2 weeks, and we can get that exact number for you.
Correct. We don't have any. That's correct. We haven't had any reports.
This is in the context of widespread report of, I believe, 20. Ramsey, how many outbreaks do we have now?
We currently have 16 active outbreaks.
So
and
go ahead, Ramsey.
Oh, sorry, I was just going to say, and our last farm outbreak was rescinded very early this month of March. Sorry.
So we've had 16 outbreaks in other settings in the health district, and we've not had a single reported case of COVID in the residences of agricultural enterprises. We are concerned about the availability of testing and perhaps the less than robust reporting of disease activity. And I think that we have to monitor moving forward to see if there is additional reports or additional activity in agricultural enterprises and other congregate settings. I think one of the things in a move forward basis, and you know, we've talked a lot about normalization. Normalization also means more robust and available testing, because that'll give us an idea of the level of disease activity in the community. And that is one thing that I think that I would hope that as time moves forward, if we do have the ability to test people, that we as a move forward strategy have enhanced testing availability for people related to COVID.
Thank you.
First questions from Blackburn News.
Yes, I'm coming in late, so forgive me if some of these questions have already been asked. I have one for Ramsey. Does our wastewater data give us any indication of how many cases we actually have in Windsor-Essex? And I bring this up because I had a story this morning from the Toronto Star that the Science Advisory Table was estimating that there's 100,000 a day across Ontario looking at the wastewater data. Does that give us any picture at all what the local number could be?
Not in terms of the wastewater surveillance. However, our what has been used in the past is our high risk cases. Typically, it's anywhere from one high-risk case can represent up to 10 cases in the community. So that ratio has been used in the past, but once again, with no robust testing measure in place, it's really hard to give an approximate number for how many cases it could be.
The other thing that that the science table mentioned was that our hospitals could be at risk of being overrun again because of this. Is this a concern that we have here in Windsor-Essex, that because we don't have the robust testing and because we're estimating that one high-risk case could represent 10 in the community, is that a concern here?
I'll speak to the first part, but I'll pass it over to Dr. Necessary to comment more. Our current hospital capacity has been for the past couple of weeks hovering at about 100% for our acute beds. We are seeing an increase in hospitalizations as it relates to COVID-19. So there's a possibility. I'll pass it over to you, Shankar, for additional comments.
Yeah, as more people are infected, there will be more people who will require hospital services, and as there are more people who require hospital services, there are more people who need ICU, intensive care unit services, and there'll be more people who need to be on a ventilator. That's just sort of a basic construct in medicine. Before the pandemic, hospitals were struggling to meet the demands of the community. That was before the pandemic. Hospitals were stretched to their resource envelope before the pandemic. And with the pandemic and with the additional burden of COVID, as we all, or at least I, remain concerned about the hospital's ability to meet all the demands. Not only do we have to meet the immediate demands of a surge in cases, we also have to catch up on the services that we deferred during the previous 2 years. So I think there is a very significant risk that if we that hospital resources may not be sufficient to meet a potential demand related to additional COVID cases presenting. Always challenging to predict the future, but my feeling is it's always better to be cautious and anticipate increased service demand as we move through this phase in the pandemic.
Okay. Another question, maybe this one is for you as well, Dr. Nezathuri. We had a message yesterday. As you know, the province announced yesterday that this morning it was going to start taking appointments for a fourth dose. We had a message that the number here locally was disconnected. And when the person called the health unit, they were told to call a pharmacy. The pharmacy said they were unaware of the fourth dose rollout. Was the public health unit notified that it should prepare for a fourth dose rollout before yesterday's announcement?
Many times as medical officers of health, we're given at least some advance notice of the policy choices moving forward. The level of advance notice might vary depending on the particular announcement. We're asked to keep certain items in confidence. But as a general matter, there are two things that come to mind. One is that I think many individuals in the public health service recognize that additional dosing, and we've spoken about this for I think some period of time, that there's going to be regular repeated or regular boosters being offered to people. So I don't think that was a surprise to anyone at the public health service. It was the timeline that's more difficult for me to comment on, but perhaps Nicole can supplement that part of it.
I was just going to add that, I can't speak to pharmacy notification. The ministry communicates directly with pharmacies, and pharmacies also order their vaccine directly through the ministry. So, and I know they have a process for engagement. I was just going to acknowledge that, as you probably know, we had a previous booking line, and that was, that booking line, when we moved to just walk-in only for COVID, we decommissioned that booking line, and we are adding both bookings back to our website. That'll be up as of today, as well. Individuals will be able to, if they can't book through our online portal, they will be able to call through our health unit and be, sent to someone who will be able to book them by phone, similar to a process that we had before with the previous booking line. So, I was just going to acknowledge that, and we are moving very quickly to get all of that up and running, but we should have everything available today. And like I said, bookings for our site will start on Monday as well. Obviously, pharmacy has always been an option and will continue to be an option for vaccines as well as primary care.
So to clarify, you did have a heads up that the province was going to offer the fourth dose to those 60 and up before they actually made the announcement, though.
A very short. We had a short timeline of runway for moving forward.
Okay. The last question I have, and I apologize for so many this morning, but do you anticipate that a lot of people, Nicole, are going to want their fourth shot? I was just looking at the uptake for the third dose, and it's still around half of the population that's eligible.
Yeah, so we do know, we are concerned about uptake for fourth dose. As with every time we've had an announcement, there is a eager group. So we anticipate, initial demand probably will be high, or we hope it is. But I don't know that we're expecting the full 100,000 that Dr. Necessary mentioned to rush out this week. But we are, planning accordingly, and we will monitor our volumes and make sure that there is access for everybody within the community. If that means for us popping up more opportunities, we'll work with our partners to do so. But we are and continue to be. And I'm sure Dr. Necessary will have comments about this, but we are, concerned about the uptake in vaccination. We continue to recommend everyone should stay up to date. That's part of, it's a really important, critical part of our response to COVID, is that everyone remains up to date. We are hopeful that this announcement with fourth doses will encourage some who have not yet gotten their third to go out and get their third dose. And so we'll continue to promote and work with our partners and our community to, express the importance of this initiative.
Thank you.
Yeah, well, the first thing I'd say is, for the most part, the people who are dying of COVID are people who are not vaccinated, or those people who are vaccinated but have serious medical problems. The people who have serious medical problems and are vaccinated are doing everything that they can to stay healthy. It's incumbent on us not to transmit COVID to them. So that goes to the public health measures: staying home when you're sick, wearing a mask. For the people that are unvaccinated, we still have things to help them, and that includes getting antivirals to them, our antiviral medications to them when they present with COVID-like symptoms. That requires individuals who are unvaccinated who meet the eligibility criterion to go to the doctor, get a test, go to an assessment center, get treatment. So I think there are things as we move towards normalization. Fourth doses getting people up to date on their vaccine, which for many people will be a fourth dose, is a good step. I think for those people who are eligible for antiviral medications, to recognize that they are eligible, see their doctors, get treatment. I think that's another incremental step in trying to manage the pandemic.
Thank you.
Okay, I think we have time for one final question from everyone, starting with AM 800.
I'm good, thank you. Have a good day.
Thanks so much. CTV?
Yeah, just one more quick one. Do you know if there are any plans to open up PCR tests to more people at any point?
I think that where we are in the pandemic and as we move towards normalization, so long as we have capacity within the health system to offer expanded availability for PCR testing, we should do that. PCR testing is superior to rapid antigen testing. Ramsey can correct me again, but I think that rapid antigen testing has a sensitivity in the 60s, in the 60% range. I think 67 is the last number I remember reading. So that means that if you have COVID, it'll only turn out positive, or it'll only pick up about 2/3 of those cases. PCR has a higher level of sensitivity. So I think as a plan moving forward, and as a matter of trying to normalize our management of COVID in the pandemic, I think that we should expand availability for PCR testing so long as it's consistent with our resource envelope. I think we continue to articulate that as an important public health priority moving forward as well.
Thank you.
Final question from CBC.
No, thank you.
Thanks so much. Final question from the Windsor Star.
Yes. WeCost, the Windsor-Essex Community Opioid and Substance Strategy, recently released an alert regarding the number of opioid overdoses for the period of, I believe, March 28th to April 3rd. Is the health unit aware of this being attached to any specific occurrence or phenomenon in the community?
So I'll actually turn it over to Ramsey, who manages our alert system and can provide some information.
In terms of the substances involved, the majority were fentanyl. 6 of the 9 were fentanyl. The majority were in Windsor, specifically concentrated in the downtown area. But in terms of the possibility of looking at what the street drug of choice might be, we don't have that level of specificity.
Thank you. I appreciate that.
No problem.
Yeah, if we could just supplement that. A good number of people who die of opioid use die when in their home, at someone's home, and someone is relatively close by. And so if members of the community have any inclination that someone in their household might be using opioids, get an naloxone kit and have it on hand. It's one additional measure that we can do to try to keep people safe. The number of people dying of opioids is heartbreaking. And these reports are a signal of the level of burden of disease that we're facing related to opioid use. There are a suite of measures that we can do to try to mitigate the consequences of opioid use and other substance use disorders. That includes a safe consumption site. It's one more incremental step. And I remain optimistic that we'll be able to have that additional resource available to the people in this community.
Thank you, Doctor. That's helpful.
Final questions from Radio Canada.
No, thank you.
Thanks so much. And final questions from Blackburn.
Just an inquiry that the recording will be going out later.
Yep, it should be posted shortly after.
Thank you very much for your patience this morning.
Thanks so much. Thank you so much, everyone. This concludes our media briefing for today. Our next media briefing will take place on Thursday, April the 14th. I hope you all have a wonderful Thursday.
Thank you. You too.
All the best.
Thanks. Bye-bye.
Bye-bye.
Thanks.